Hello, folks. Happy October 22nd. We're here with Dr. Philip Ovadia. I'm Brian Keith on Ovadia Heart Health team. And we are talking today about telemedicine and what it looks like to have your doctor be one phone call away or one messaging app away. And it's a curious thing because Dr. Ovadia here is a heart surgeon, which is the least telemedicine of all things. And so I'm curious, Dr. Vadia, you went from I will be there in a room, standing there for 12 hours at a time with a scalpel in my hand, to thinking it would be a good idea to not even meet your patients in person. What's up with that?
Yeah, it really, shows this evolution from doing the procedures, right? Doing the things, putting your hands, needing to put your hands on the patient because their condition is so bad that it warrants it, to really wanting to be able to prevent that and be proactive and not have to wait for someone to be in bad enough shape to be laying on the table in front of me. And as I've seen the evolution of medicine over the past, 30 years since I, started in this field, it's amazing to think if you had come to me 30 years ago as a young medical student and said, you won't need to be in the same room, same city, same country as your patients anymore in the future, that would have seemed just amazing and bewildering. So we are certainly, I believe, at the point where we can do that for things like preventative care.
Well, let's key in on that phrase, preventative care. When I think about going to the doctor or going to the hospital, I never go to the doctor unless I'm sick. And then if I'm so sick that I go to the doctor, it's because I'm broken in some way. Like, oh, I hit my knee, I fell and hit my knee on a tile staircase a year ago. Like, oh, this knee is no longer working properly. And that's when I was last seeing a doctor because like there's this weird crunchy noise in my knee. Something is wrong. And that's the context in which I go to a doctor. But that's not the context that people are talking to you.
Yeah, very true. And, realize that, what you mentioned, right? Going when something is wrong. That's what our traditional medical system really excels at, right? People, talk about the Western medical center, Western medical system, the American medical system, really, because this is where this started from. And it is the best in the world at taking care of you when you're sick. It may be the worst in the world, but it's certainly pretty far down there in keeping you from being sick. And that's why we need to change the way that the traditional medical system works, right? You're having a heart attack, you come into the hospital, you're going to get the best care, you're going to end up on my operating table. Great. But if we want to keep you off my operating table, the way that the traditional medical system has functioned is lousy. And that's what we needed to change. And that's what we've been seeking to change. And one of the aspects of that is, telemedical care. And it is great for the preventative work that we do in our practice.
If you're not in the same room with me, how can you know if I'm sick? When I saw that doc, for my knee, he poked around my knee, listened to the weird grinding noise that really shouldn't be there, had me hobble down to get some kind of x-ray or something where some text did all this other stuff. And then he went and looked at the x-rays and said, here's what's happening. Do this next. Wear this brace for this long. And then set me on my
All right. It looks like Brian may have froze up, but so I'm going to jump in. Yeah.
Yeah. Go ahead and you can continue. I'm sure we've got over 200 people watching this right now, and it's growing fast.
Definitely so. So, the question that Brian was asking is, how can we do that without being in the same room? And, think about the scenario that Brian was describing and how much of that can be done not in the same room. And maybe it's not ideal, again, when you're sick. But, Brian was describing, the doctor examining his knee, feeling his knee, observing his knee. And yes, you can't, with our current technology, effectively do that via telemedicine, but I can still observe. I can ask Brian to move his knee in certain ways. I can be listening to maybe the sounds that come from that. Brian can be describing to me the sensations that he's feeling with that. And then, okay, you need to go get an x-ray, right? And this is something we oftentimes do for our patients remotely. We figure out where they can go get an x-ray done. And again, in an acute situation, the answer is, yeah, you should be dealing locally and going locally. But in a preventative situation, we have lots of options for how to do some of these things. And we can leverage technology very effectively, right? I can send you a remote blood pressure monitor that then reports back to me what your blood pressure is. Not at the one moment that you show up in my office, but throughout the day, over many days, over many weeks. I can see what your glucose is with a continuous glucose monitor. There are lots of technologies that we can now leverage to enhance what we're able to do without being in the same room.
Am I back? Is the question.
You are back.
So, how do we know if we're sick? You talk about preventative maintenance. That's all well and good. What's the right percentage? Because I don't feel sick right now. Woke up, got a reasonable night's sleep, given that I have an infant son. Have enough energy to do what I have to do today. I will end the day tired and ready to go to sleep. I'm going to have a great night of sleep tonight if my son allows it. But I sleep well. I eat well. I can move as much as I need to move. And I'm 40. So one of the things you say is that you want to catch things long before they become observable. How do I know if I'm sick or going to be sick in the way that talking to someone other than my insurance provided doc I can get down the street is appropriate?
Yeah, this is where prevention and screening comes into play. Being proactive, and it can be simple things like paying attention to the metabolic health markers that we talk about. What's your waist circumference? What's your blood pressure? Some basic lab work, right? What's your blood glucose? What's your HDL cholesterol? And what are your triglycerides? Maybe you want to go beyond that, right? If you have reason to be concerned. And we get more advanced lab panels. And we're proactively looking for the indicators that you might become sick, right? Because by the time you're sick, and this really applies to almost everything we deal with in medicine, by the time you're sick, you've missed that opportunity to prevent it. And no matter how good we might be, maybe at treating your sickness, your illness, right? If you never got sick in the first place, you would have been in better shape. So this is where being proactive about your health, taking charge of your health, and working with practitioners that are focused on preventing sickness rather than treating you once you're sick. That's the advantage that we look for, and that's what our practice here is based upon.
Let's go for a question here to our YouTube audience. For those of us watching us on X, our software doesn't allow your comments to directly show up on our screen, but for those of you on YouTube, I can just pull your comment right up here. So for everyone watching us on YouTube, here's the question for you to answer. Yes or no question. The last time you went in to see your doctor in person, did they spend a significant amount of time talking about preventative care? Put a yes in the comments there on YouTube. If the last time your doctor talked to you in person, they spent a significant amount of time talking about preventative care, and then type in no if they didn't. Go ahead, toss those. I'll see them here on my screen. And the reason I'm asking this is I'm curious because the objection to telehealth is, well, what can you really do when you're just talking to somebody on a screen or on the phone? But if your in-person doctor isn't doing that preventative care, here the answers come. There's a few second delay, but now I'm starting to see the answers here. Well, let's see what the answers are here. Looks like two not autos in a row. Okay, wait, crap. We have one yes, and that person still had a heart attack. We have a yes, but they wouldn't order test I wanted. This is horrible. Okay, no. So even the kinds of health-oriented people that are subscribed to Dr. Ovadia's YouTube channel still are a resounding no. That even talking to people in person doesn't get you that. So really, it's just the you're waiting for your car to break down, then you take it to a mechanic. That is apparently for the people watching today. That is the level of care that their doctors, their in-person doctors, are currently providing. When you see that, Dr. Ovadia, are you surprised?
No, unfortunately, I'm not. And interestingly, earlier today in heart surgery world, I was having a conversation with a patient exactly around this. And, I was asking the patient about their, did they have indications that they had heart problems? And they said, no, my doctor told me I was at low risk for a heart attack. And yet, there they were seeing me for potential heart surgery. So
how do people feel? How do they feel when they're talking to you and they say, my doctor said I was fine, and you're there in your scrubs because you just performed heart surgery on them? What's the emotional, how do they deal with that if they've been told for years you're fine, and then they're having to talk to some guy who just had a knife in his hands?
Yeah, no, I think this is some of the disappointment with our healthcare system, right? Because patients don't want to be sick, right? They end up sick, but they don't want to be there, and they would much rather. I have never had a patient tell me, that when I present them with options like, okay, we can do this to prevent your problem, or we can wait till you get sick and then we'll go ahead and do surgery. I've never had a patient say to me, yeah, I want to be sick, I'll wait, and I'll come back and see you when you need to open up my chest to deal with this. Let's deal with it earlier, or let's completely prevent it when we can. Patients always want that. It's unfortunate that they're oftentimes, maybe usually we'd say based on those responses to the question, they're not given that option. And the way that, again, traditional healthcare system works is, yeah, you're going to go get your routine physical and you're going to see your doctor, once a year. But the doctor is really there to take care of you when you're sick. And so we need to start flipping that. And when I say we, I mean we, the patients, you, the patients out there, you, the people watching this. You need to be more proactive about your health. And no, I don't want to come see the doctor when I get sick. I want to avoid seeing the doctor altogether
at all
by doing this preventative work.
Let's go over here to the comments and let's talk about medications. We've talked about your ability to actually look inside someone's knee, see what's going on there. We have a comment here from Dan watching us on YouTube with some specific numbers here, talking about their doctor suggesting the possibility of statins. When you're not seeing people in person, how do you evaluate when to prescribe medication and how to balance that out with other lifestyle changes someone like Dan could potentially do?
Yeah, again, when you think about the last time you were in person with your doctor, and really think about, how much of what they did couldn't be done over telemedicine, over remotely. If you're talking about, Dan's question is reviewing labs, right? There's no reason we need to be in the same room to do that. We can be, literally around the world from each other. And, I can look at your labs and I can interpret your labs for you. And I can use that to judge, what we do about your health next. There's very little, outside of the procedures, right? We're not doing heart surgery by telemedicine yet. Maybe we'll get there. But outside of procedures, there's very little that doctors do that can't be done remotely. And we find it's more convenient for both the patient and, honestly, the doctor. And it's also opens the possibilities of working with practitioners with a wider, focus, let's say, right? Because one of the most common things we hear is, I can't find a doctor locally that thinks the way you think, that wants to do this preventative stuff. And our answer is, you don't need to. Come see us, telemedicine. lots of great telemedicine physicians, lots of great preventative physicians that are doing things over telemedicine, and go seek them out. You don't need someone to be local to do this.
I'm laughing because I went to my insurance paid for PCP and I said, hey, I'm about to be 40. History of heart disease. It's killed a bunch of folks in my family. Can I get a CAC? And he said, no, you have no symptoms of heart disease. And I said, but my heart doc client said it's a pretty good idea to not wait till you have symptoms of dying to even look. And the doc said, he's a friendly guy, but I don't want to wait until I'm about to die here. Now, we have a bunch of comments coming here in the questions, and there's people asking very specific, detailed things here, which we love these detailed questions. And I want to talk to you about how you get Dr. Ovadia actually able to answer you here on these. Because Dr. Ovadia has a actual medical practice, a license, all that stuff, Dr. Ovadia can never answer direct questions like this on a live stream because he needs to spend a lot of time talking with you before he can give you an actual answer. If Elsie, if Elizabeth, if Shea, if Dan, all these folks with very specific questions in the chat, if you were already members of the private practice, then you would have a messaging app where you would send in any of these questions. And someone on our team, one of our medical providers, would look at that and then route you appropriately, which in some cases might be our nurse practitioner. In some cases, might be Dr. Ovadia. And in some cases, that might be next week or tomorrow. And in some cases, might be immediately, as soon as Dr. Ovadia can be gotten on the phone. Can you talk with us a bit, Dr. Ovadia? Because we're used to the model of if you're sick, just go to urgent care or the ER, and someone will deal with you immediately. And some of these questions are very urgent, like this right here. Elizabeth's question, yes, this is urgent. This really matters. And Elsie's question here, that sounds like it really matters, and it matters right now. We don't want to wait here. So how does that relate to how people can get answers from you immediately?
Yeah, and this is something else that I think has become more challenging in our medical system, right? We, communicating with our doctors and has become a challenge, right? Because chances are you can't get an immediate hold of your doctor. You call your doctor's office. It might go to an answering service. It might go to their desk. Then they are going to get a message, and then, maybe you'll get a call back. Maybe it will be a couple of days later. Doctors are busy. Doctors' offices are busy, right? They're overwhelmed taking care of sick people. And, sometimes it's hard to get attention. We intentionally keep our practice on the smaller side, and we value, pretty direct communication with the practitioners. So we use a messaging app that, when patients have concerns, they put it in the messaging app. And, I'm looking at it. Lisa, our nurse practitioner, is looking at it. Our health coaches are looking at it. And our office staff is looking at it. And we're appropriately delegating, who answers it. But you're going to get an answer relatively quickly. And it's a more direct line of communication. And if it needs an appointment, we're going to work to find you an appointment, to discuss it in more detail. But again, that's within patients that are in the practice. And that's one of the advantages we offer over most traditional medical practices. And because we're sort of we intentionally keep our practice on the smaller side. Most doctors who are trying to make a living out there, primary care physicians, primarily that we're talking about, they have to have large panels of patients to be able to, maintain their office and pay the overhead and pay themselves a reasonable salary and all of that, because they're locked within this insurance model that really doesn't value what they do. And so we've set a different model, and it's been working great. And if you ask our patients, I think they would say that they feel very well connected and listened to, and they get a good good responsiveness to their concerns.
We have a question here from Shia about using insurance. The answer is no, that we don't take insurance. There's all kinds of restraints that come with accepting insurance into your practice. And the level of responsiveness that Dr. Ovadia is talking about is the opposite of that. As sadly, I see a note here from Chris about a doctor saying, don't message me. Talk to me only during that's
yeah.
Don't talk to your doctor. I'd pull my hair out.
You know, you need an appointment to talk with your doctor, and then during the appointment, you don't even have time to talk with your doctor. You know, that's the sad reality that many people find themselves in. And again, a lot of that is driven by insurance. So going back to the earlier question, why don't we take insurance? It's because if you take insurance, you get locked into that model of care, and that's not the type of care that we want to deliver. You know, when your focus is only, you know, kind of using what your insurance company will allow you to do, it really limits your options. And one of the things that we talk to people about is investment in your health. And that sometimes is a monetary investment, that sometimes is a time investment, you know, mental energy investment. These are things that become necessary if you want to do better than the insurance model. We can look all around us at what the insurance model has gotten us when it comes to our health. And if you're not satisfied with that, you need to go beyond the insurance model and start making some of those outside investments in your health. But I can promise you that most of our patients would tell you that investment has had a positive return on investment, to use the financial term.
Yeah. Another question for our YouTube audience here. Have you read Dr. Ovadia's book, Stay Off My Operating Table? Or have you listened to his podcast, the Stay Off My Operating Table podcast? Or have you seen Dr. Ovadia speak at a live event or gone to a booth like a Hack Your Health, where we've had a booth at a live event? Go ahead and toss in the comments either book, podcast, or event. And let's see how many of the 100 people watching us on YouTube right now. Sorry, 300 Twitter followers or watchers, you can't comment directly, but you can comment on the post on X, and we'll see that later. While you guys are writing that down, either book, podcast, or event, let's talk about what it looks like if you think you want to talk with Dr. Ovadia. ifixhearts.com/talk is where you can get on the calendar for our metabolic health coordinators. These people are people who are asking you, okay, what's going on? What kind of solution are you looking for here? And they'll help route you to all our different levels of service, all the way from Dr. Ovadia is the guy you work with directly. You don't even talk to a nurse practitioner. It's just Dr. Ovadia, all the way down to maybe you just need to have your labs looked at once, and a nurse practitioner who has decades of her own experience and also works side by side with Dr. Ovadia. Lisa, looking at your labs is actually a completely appropriate answer to the questions you have. ifixhearts.com/talk is the place to go. Start that conversation. Now, heads up, it's October. Dr. Ovadia, your initial consults are being booked for February. We just got done telling you that responsive medical care is the future. And then I'm going to say it's February until you can talk to Dr. Ovadia. That is for new people, because all of our current people already in the practice are the ones that Dr. Ovadia is texting back and forth with on a messaging app, and our nurse practitioners texting back and forth with. And so we prioritize the experience of our current patients 100% over the experience of new patients. And that's why it's all the way out in February. But you said some interesting things, Dr. Ovadia, about people who, by the time they talk with you, because it is 3 to 4 months for that initial consult, because of their experience in your practice before that first conversation, you said they often already have some kinds of results. Can you talk about that a little bit?
Yeah, one of the innovative things that we do in our practice is to get on my calendar, right, might be a few months off. But before you get on my calendar, you're actually going to have multiple visits with other members of the team. You're going to meet with one of our health coaches multiple times. You're going to meet with our nurse practitioner, Lisa, that we mentioned. And so while you're waiting, it's not a passive just waiting, X number of months. There are things being done. We are going to be getting testing that we recommend during that time, so that when you do get to the visit with me, it's going to be a comprehensive visit, right? And a lot of the work has already been done, and you and I can spend that hour, which is our typical consult time, really focused on the issues that need my attention. While a lot of the other, like I said, work has been done already. And we do have a system in place, right? That if you have an urgent problem, we have ways to kind of prioritize and get you sooner appointments. So lots of different options for working with our practice. It's a very comprehensive team-based approach. And don't be discouraged, because you may not actually get to talk to me for a few months. Like Brian said, by the time you talk to me, there's a good chance you already will have made vast improvements in your health, and you're already be well down the path that we designed for you.
Wonderful. Now we have one of our health coaches on the backstage right now. We're going to bring him on here in just a moment to talk about his experience that he brings to the team. But real quick, we asked about, where did you come across Dr. Ovadia? And let's go ahead and see what we got. We have the book and the podcast. We have a 1 weekend read on the book there. We have the book. We have the book and the podcast. We have an event, says Leo Bat Acapulco. Excellent name, sir or madame. Which event? Was it Hack Your Health? Was it somewhere else? We have Chris on the podcast. We have Ursula, book and podcast, book podcast. The podcast, whatever app you listen to, stay off my operating table. For the book, you can go on Amazon or somewhere else. And then, we have another. So many stories like that, Shay. I'm sorry to hear that. Book and podcast, and then more book and podcast. We got a lot of folks listening to both there. And the book is wonderful. Yeah, people pass around the book like crazy. Absolutely. Buy the book, then give it to your friends. Dr. Fady is on a mission to prevent 1 million heart attacks. And every time you hand the book to somebody else, you're helping us out with that plan. And then we have Karen here's on the podcast. So that's wonderful. Now, real quick here, we're almost out of time for today. Briefly, here's Chris Cornell. Hey, Chris. He is a coach with Ovadia Heart Health. And before we go and wrap up for today, Chris, I want people to know that when they work with one of these folks that Dr. Ovadia is putting in front of them, that they're working with people that have done something, not just taken some class or read some book. Could you give us the 30-second version of how you transformed your own health? That is why Dr. Ovadia is trusting you to coach his patients.
Yeah, sure. And first, I'd like to cast my vote for I read the book and I also listened to the podcast.
Me too.
And I have taken a lot of courses, I'm a coach and a metabolic health practitioner, but I personally use a low carb, well-formulated low carb diet to lose 80 pounds sustainably. And I'm now going on my 7th year of living without 80 pounds of excess weight burdening me and preventing me from doing the things that I love to do. And I can't tell you how much my life has transformed, and I really enjoy working with other people to do the same thing for them, because it's just such a transformational thing to be able to do that.
Okay, thanks, Chris. We got a wrap for today. 419 people watching at this moment. It'll be over 1,000 by tomorrow, and that's because you all know that taking care of your health and taking responsibility for your health is the cool thing to do. Dr. Ovadia is here to help you in that path. And if you want to go get started, just DM us anywhere or ifixhearts.com/talk. Dr. Ovadia, thanks for your time.
Great seeing everyone.